gouvernement. Cette personne aurait la responsabilité de...
On Wednesday, August 5th, the Association of Psychiatrists of Quebec, AMPQ, held a press conference outlining key measures to combat mental health ahead of this year's provincial election.
We're calling for a few things, but that mental health become a priority, that there's a minister appointed to it because the dossier is complex and the needs are great and getting more complicated. We're calling for an action on homelessness. That's why we're here at the Old Brewery Mission, and that's why we want a concerted action on this, which has started but needs to be full circle. We want to act on a few parameters of actually getting healthcare outside the hospitals, into the community, into the streets, and actually connecting those dots, which is really a priority for us. Increasing access to different modalities, including telemedicine and telehealth, which essentially for our regions, our faraway regions that may not have all the care, to improve that. And to do really one thing that's really important, I think, is to work on prevention and to look at suicide, which we talked about right now is basically tripled with youth and essentially is a huge risk factor for older men as well. So I think what we're actually doing is calling to action our politicians, holding them accountable to things that we can actually work on. Tangible results can be coming out of these 6 measures that we're proposing.
5000 personnes en situation d'itinérance ce soir à Montréal.
In addition, the association wants politicians to prioritize the health of caregivers and health professionals. They are also asking for the province to be more intentional with mental health care.
And that's the thing that's missing right now. We are asking obviously for more resources, but actually for resources to be spent more appropriately and in a more focused way. So I think what we're asking for is to have an intentional action from our government and something a bit more stable that actually survives the cycles of election, which we experience every 4 years and everything changes. That doesn't help the system, that doesn't help the people that are working in the system. So actually we're making a call to action on many branches.
Another focus in the proposal is promoting healthcare beyond hospitals.
Focus of keeping people at home and for a focus on innovating on healthcare. Healthcare does not revolve around the hospital necessarily, it can expand, and that's what we need to do. We need to get out of some of these traditional methods that don't actually work, and we have evidence to support that.
Ces progrès montrent que la prévention peut fonctionner.
Dr. Claire Gamache, the president of the AMPQ, says that these measures are more than just suggestions.
Il ne s'agit pas d'une liste de vœux, d'une liste de dépenses. Il s'agit plutôt d'une feuille de route réaliste fondée sur notre expérience clinique, les données disponibles et les meilleures pratiques.
Parties are yet to release their platforms. However, the AMPQ invites them to make mental health a priority. Quebecers will vote on October 5th. For Local 514, I'm Jordan Hashi.